Hi, everyone. We're so glad you joined us today. We have Jane with us, who is a physical therapist at Collins Rec Center. And so we're very excited for her to be here. I'm sure she'll tell you a little bit more about who she is and what she does, but our topic today is all about fall prevention. So I will turn it over to Jane. And again, thank you for being here.
Hi, my name is Jane Thurm, and I'm a physical therapist at the Rec Center Physical Therapy. I specialize in Pilates for rehabilitation, and we work with all sorts of populations in this setting, whether it be younger individuals, middle age, definitely seniors. We're attached to a health club, so we do see a lot of seniors and retirees and have a lot of experience with that population as well. So today I'm going to talk a little bit about falls and fall prevention, both for caretakers, because typically if we're caretaking for someone, that caretaker is older too. So it's helpful for them to know how to take care of themselves, because we know that if you, as the caretaker, can't take care of yourself, then you cannot take care of your loved one too. So super important for self-care and to be able to take care of yourself. And then also you want to be there for that person that you're caring for and help them prevent falls too. And then maybe like, how do you get off of the floor? What are some strategies? So I'm going to give you some facts, which is always a little bit alarming and kind of pulls you into the whole meeting today, and how hopefully you'll learn then why it's so important to try to prevent falls too, because of what are the consequences and implications. What can that do for you? So we'll talk about some risk factors of what puts people more at risk for falling. So those are some things maybe you can modify too. And then exercises and some movement strategies to reduce your risk for falling, and then some things in the environment too. So that's where we're going to go with this. So falls are a threat to the health of older individuals and can reduce their ability to remain independent. However, falls don't have to be inevitable as you age. So today I'm going to talk about how you can reduce your chance of falling or help a loved one to prevent falls. This information comes from the Center for Disease Control. Each year, millions of older people, and when I say older people in this presentation, it'll be 65 years or older. Each year, millions of older individuals fall. In fact, 25% or more than 25% of older people fall per year. Falling once doubles your chance of falling again. And each year, 3 million older people are treated in the emergency room for these falls, and over 800,000 patients are hospitalized because of a fall injury. And in 2015, the total medical costs for falls totaled more than $50 billion. So what are some of the effects of falling? What happens? What are some of the implications or the consequences of falling? Why is it so important to try to prevent these falls, besides healthcare costs and putting you in the hospital? 1 out of 5 falls causes a serious injury, most commonly a broken hip or a head injury. And 95% of all hip fractures are caused by a fall. Each year, at least 300,000 older people are hospitalized for hip fractures. And remember, 95% of those are from falling. Falls are also the most common cause of a brain injury. And in 2019, falls for those over 65 years old caused over 34,000 deaths, making it the leading cause of injury death for that age group, which I thought was alarming. So we really need to try to prevent falls to decrease mortality rates and help improve people's independence. So what makes someone more at risk for falling? We're going to talk about things maybe we can change so that we're less likely to fall. One of them is medication, such as a vitamin D deficiency, or tranquilizers, sedatives, or antidepressants. I'm not super well versed in medication. This is where you would have this conversation with your medical provider to maybe talk about how the medications can affect your alertness, for example, because we know that if you're more tired and drowsy, you're more likely to lose your balance. So talking to your physician about, levels of alertness and how it affects that, or even just how the medication may affect your balance in general. Another risk factor for falling is environmental. So are there things in your environment you can change? We'll talk about that in a little bit, such as clutter, throw rugs, that type of thing. And lastly, another thing that makes someone more at risk for falling is more physical things. And as a physical therapist, we see clients all the time in this setting that are referred to us for falling or that have decreased balance, may not have fallen. So that's where we are kind of the specialists of exercises and movement strategies and general movement. So I'm going to spend most of my time today talking about the physical risk factors for falling and what can we do about that. So one of them is just general weakness, especially in the lower extremities. So we know that if your legs are not as strong, they're less likely to support you, more likely to give out, and that can increase your risk for falling, of course. So there's some certain exercises that I like to give that help improve lower extremity strength, but are pretty doable to the senior population and easy enough to instruct. Not only the caretaker can do them themselves, but also to their loved one. Pretty simple. So that's what I've chosen today. So we're going to turn the camera and I'm going to show you a few exercises. Before I do that, where we're switching the camera a lot, so one of the risk factors physically is weakness, which we'll address. Poor posture, balance, of course, because if you have poor balance, you're likely to fall. And poor movement strategies. How are you moving? Can we make it more efficient and safer so that you're less likely to fall? So we are going to turn the camera and I'm going to show you some exercises to improve your lower extremity weakness so that you're better supported when you're on your feet. And then we'll talk about posture and all the other things I've spoken with. So we're just going to turn the camera and I'm going to show you some exercises. Okay. So one of the exercises works on strengthening your hip muscles, which is important to support you in standing. We call it the clamshell. It's a very popular physical therapy exercise, actually. And it's easy enough because most people can lay on their side and do this fairly well, especially if they have the hip mobility. So you're just going to line your posture up. Your knees are forward. And your feet are about lined up with your hip, your shoulder, and your head. So you're in this alignment with your knees forward and bent. And you're going to try to stay forward on your bottom hip. And then just lift the knee up and down. And because it's a strengthening exercise, we work more on not holding it as long, like a stretch, but more repetitions to get the muscle tired and kind of overloaded. Typically, if people have hip pain or a problem one-sided, we do recommend doing this on both sides. Most people could benefit from this. And a lot of people are really really weak in their hip muscles. So right back, kind of in the back pocket area is where I'm feeling it. So super important just to stay kind of rolled forward. The tendency is for people to roll back on their hip, and then you're not working the right muscle. So isolation is best if you're a little bit forward even, ideally pulling in your abdominals, and then just lifting the knee up and down without rolling back. Usually I'll have people do, it depends on their level and how they're doing. Every patient's different. Roughly 2 sets of anywhere from 10 to 15. And then you could do the other side in 1 to 2 times a day. It really depends on their level of function. My goal is to never fatigue them too much where they cannot function throughout the day because that's very frustrating. So, pacing themselves with activities or exercises. If they're a patient in physical therapy, I will usually discourage them from doing too many other things during the day, exercise wise, because I want them to enjoy their other activities and be able to stay in their activities. I don't want to put them more, I don't want to make them too tired where they're more at risk for falling and can't complete the things they need or want to do, because that's super important too to their lifestyle. So exercise 1 is clamshell. And then another super easy one for people to do is a straight leg raise. So you would bend one knee, and that will help with back comfort. Gently hold your belly button in. Tighten your thigh muscle as if you're pushing your knee down into the mat. And then lifting your leg up. So lifting up a straight leg. So straight leg raise. Ideally, it depends on the person. If you could hold it 3 to 5 seconds and then lower down with control where it's not super fast, that's gonna work on strengthening. So then you just tighten your quadricep or your thigh muscle, lift your leg up, hold it for a few seconds and lower it down. And then you can release the muscle. Similarly, for repetitions, if you're doing about 10 to 15, if you can do 2 sets, so you can alternate in between, do the other leg, and then go back and do the other leg, and then switch again. So 2 sets of 10 to 15. And again, once a day is fine. If you have more energy and you want to do twice a day, that's fine as well. Another exercise is, my sheet here. Is called bridging. This is a great exercise. I'm going to just get rid of my pillows here. I'll be talking about it in a second. For this works a lot of different body parts. It works on your glute muscles, your bottom muscles, so strength, which is in this category, but it's also a really nice hip opener and shoulder opener, which are great for posture. It also works on spine mobility as well. So all you're going to do, ideally, if your posture is fairly good, no pillow. Otherwise, if you lift up, you'll feel like you're choking. But if someone has a really rounded posture, they may need a pillow for head support and comfort. So what you do with this exercise, bridging, is you're going to tuck your tailbone, lift your bottom up, press strongly through your heels so that you're in a nice straight line, like a plank or like a board. So you're pushing through your heels, you're tightening your bottom, your knees are hugging the midline so they're not flaring out. Your shoulders are down. So in this position, I'm working my glutes, my hips are open, my shoulders are open because my arms are pressing back. And then you would roll back down through your spine, keeping your head and your shoulder blades back. So again, you tuck your tailbone, flatten your back, peel your body up like a banana. Take a breath in, or you can take multiple breaths through this. Just don't hold your breath. And then you roll back down without rounding forward. So it's a good shoulder exercise as well. So that's it for this one. You can also add marching. We do that a lot. That really helps work the down leg, the supporting leg. It really engages your bottom. So as you're marching, you are trying to keep your pelvis up and keep it level. So trying to avoid dropping the pelvis or tipping it over. So your words can be a very powerful thing with this. You can be very much more mindful if you give the person the right cues. I'm going to stand up, and another great exercise is just a mini squat. So using safety, of course, is most important. So again, if we're not with them, doing this against a countertop for someone to help you is very important. So if I have my countertop here, and I'm holding on, if I want to hold on, just a mini squat. Super functional exercise, right? So it also would help not only build up strength, but also helps people when they have to get down and do things. So if you have the strength in your legs, Then when you go down to squat or get something out of a cupboard or a dishwasher, you have the strength to get you back up rather than you're in a weak, compromised position and you might fall forward. So again, all of this is building up strength to do things. Squatting is going to not only help build up strength, but be very functional for you to prevent falls when you're doing things through your day. Similarly, a wall slide. So if you find a wall, this is going to help build up leg strength again, your thigh strength, so your knees don't buckle under you to fall. Your back's against the wall, shoulder blades are back, and you're going to slide down the wall. Ideally, hold 3 to 5 seconds. Go down to what is comfortable for you with proper knee alignment so you're not out or in. Hold a little bit and then slide back up. With this one, if you hold it longer, it's going to be more difficult, and that is completely fine. The deeper you go is also going to make it harder. So if I go down further, that's going to make it harder. But I usually encourage patients, only go down as comfortable as you can in regards to, of course, pain, because we see a lot of people for pain. And only go down as far as you can, keeping your weight equal through both feet and where you can smoothly go up. So that is a good technique for this exercise. Similarly, roughly anywhere from 6 to 10 reps. Again, it's going to depend on the individual. So holding 3 to 5 seconds, 6 to 10 reps, and you could take a break and do 2 sets. Backing up to the bridging exercise, anywhere from 5 to 10 of those as well. So those are the strengthening exercises that I have, very simple. The next thing I want to talk about, a risk factor for falling, so we talked about weakness, is posture. So I'm going to grab a dowel and I'll actually stand against the black wall, I think. So typically in an older population and in general with our society, as we know, most people start to develop this sort of posture. Everything's in front of us, whether we're younger and we do tech things or we're working at our computer. For middle-aged people, everything is in front of us, nothing's back here. So the tendency is gravity to pull us forward, then you can get into a bad movement pattern, you can get stuck there. And even if you're not stuck, you just have a pattern in your head of a bad habit. And then as we get older, of course, things get weaker, things get more forward over time. So what are the implications, or what does that do for us? So people start to develop this forward head posture. Ideally, you want your posture to be as best you can when God created us, with your head able to touch a stick in the middle of your shoulder blades and your tailbone. Over time, of course, we see more of this, and then more rounding through here, and then even more dumping through the front of the hips. So you've kind of got this head position. Your head is heavy, right? So gravity is going to pull you forward, creating more of this roundedness, and then more of a bending through the hips. So how do we correct that, or what can we do? Body awareness is huge in trying to change your habit, because you could do exercises all day, but if you do 10 reps and then you fall back into your pattern, you're kind of undoing everything you try to do. So really, just during your waking hours, trying to keep your posture in its optimal position is the best medicine you can give, the best treatment. But there are certain exercises that help with that too. So we not only want to do the exercises, but also just having carryover throughout your day too, so it doesn't get undone. So one of the exercises, I'll give them on their back a lot, but also in standing or sitting, because we live in an upright position, is if someone's forward like this, I'm going to keep the stick on me so you have a reference. If you're forward like this, just gently tucking your chin towards your throat, like you're holding a peach under your chin. So just a nice, easy chin tuck. So it's not actually looking up, but it's kind of bringing your head back into this position, like you're tucking your chin over something really delicate. Not an apple where you could work as hard as you can, just a gentle peach. Then you're creating length through the back of your neck and setting your posture up in your spine for proper alignment. Another exercise that I give people are chest openers, because in this position, again, you get into this rounded, what we call kyphotic posture, where your mid-back is very rounded. So we want to be able to open, and then your shoulders get dumped forward. So we want to be able to open that up. However, I highly recommend people to start stacking their spine from the top down, because you could open your shoulders, but still have a forward head position. So I recommend you start from the top down, set your spine up, because if you bring your head back, you're already opening your shoulders, which is great. And that's what we want to do. However, if you do your chin tuck, another exercise you could do are just gentle shoulder blade squeezes, where your head's in this proper posture and you're hugging your shoulder blades together and then releasing, or using a TheraBand and again, holding your head back and then pulling back to open your collarbones further and holding this position. You can also do more of like just holding your arms in this position, your head's back, and more of a W position. That's going to help, or even further raise them up toward the wall. As long as you can maintain that head posture, you're working on lengthening your spine and keeping it in a proper posture and reducing the roundedness. And then lastly, I talked about posture and how your hips can dump forward too, right? So doing something to open up your hips is super important. So the bridging exercise is one where you rolled up and you open the hips through there for when we talked about strengthening. Another really nice exercise to open your hips. I'm on a higher surface right now, but imagine most people have maybe a table at home with a kitchen chair and sides that are open on the chair. So if you can imagine me sitting in a chair where your foot would be touching the ground, and then you bring your leg back. I'm actually going to rotate. So if my chair is here, the back of my chair, and I have open arms or a bar stool, being careful that it doesn't wheel out. Again, imagine my foot's on the ground. But so a nice hip opener then is lowering the knee toward the floor and the foot will touch the floor, and then your hip is open through the front. And then I would hold this this is a great stretch. I give this frequently because most people can do this. They can sit and do this. Like a, 10, 20-second hold typically, ideally 20 seconds. And they're just holding this, and you would do a few on each side. So really nice hip opener, as well as that bridging exercise. Whoops, that I had shown you this one. It's gonna open the hips. Again, the purpose is if you develop this rounded posture, this gets shorter or tighter or smaller. So you're trying to open it up. So if you can keep your head back, open your shoulders and open your hips, your core muscles can work a little bit better, which is very important for everything. In fact, also supporting you. Improving your posture is going to help you breathe better. It's going to put your gaze forward so that you're not rounded and gravity tumbles you down, more likely to fall to the floor. So it's going to line everything up to have you walk forward a little bit better. So that's the effects of posture. And another risk factor for falling in the senior population is also reduced balance. That's probably something to think about the most is your balance is bad, you fall. And anytime I ask anybody to stand on one leg, right away before they even stand on one leg, they say, my balance is terrible. They kind of give it up. So it's important to try to improve balance. That's something we do in physical therapy frequently. And we're here to spot you, right? Like my hands are on you. I might have a gait belt on you or my hands on you or use other things. But if you're at home and you want to work on this, most importantly, yes, we want to try to improve your balance, but you need to be safe doing it because it's kind of a compromised position. So we want to make sure you are safe when you try to work on your balance. So I think we're going to roll the camera back a little bit so that you can see my feet and what I'm doing a little bit more. So imagine I'm going to elevate this to bring up a countertop height. That's all right.
I think so.
Okay, so working on some balance exercises against a countertop is what I would encourage. So we can work on what we call static balance. So basically, you're standing in place and you're working on holding your balance. Ideally, I think here, I'm going to rotate around, I think, so that this is my countertop here. See that? And then we'll go to the feet. So standing in one position, you can do, actually, I apologize. Imagine my countertops here. I'm going to fake it, but I want you to be able to see. So a regular stance is what we live in, but making it harder, you can make exercises harder. So you can right away by narrowing your stance so your feet are together. Hold the camera down more. So just a narrow stance versus a wider stance. Narrow is harder. You can also do heel to toe positioning. That makes something more challenging too. And then in those positions, so if I adopt a narrow base, then you can add other things, right? So you can add moving your arms. You can add turning your head. That's going to make you more unstable. So, and you can do that in that heel to toe position too. So you could add lifting your arms up and down, or add turning your head, and that introduces more challenge to the person. Likewise, in the narrow stance or heel to toe stance, just closing your eyes takes away a sense of balance, making it more challenging. So if you've got your countertop, you can go from a wide base to narrow base to heel to toe, to either closing your eyes in that most challenged position, or adding arms, or turning your head. So those are some options. We also work on dynamic balance. So basically, not just standing in one place, because that's not super functional. If someone is a little bit more advanced, then they could walk forward and do things that are more challenging. And that would be where your countertop's important, or having someone spot. So you could just either march in place with a steady pace, which is very challenging for people, because when you're on one leg, you're challenging. It's more about the down leg that's supporting you. Can you support yourself? I usually have people go slow, and then you can walk forward in your march. And I'll say like you're stepping over a curb. That's very functional, because in reality, if you go out in the environment, there are things in the way, such as a curb. And then also you can, of course, walk backwards. You can do some sidestepping. You could do crossing over, what they usually call grapevine. One leg crosses over the other. That's pretty challenging for most people. But you're going to know based on that individual if you're more of a side stepper, or if that's super easy, if you want to do a crossover step. So those are some other balance exercises you can do. And also even standing on an unstable surface makes things very challenging too. And then lastly, another physical risk factor for falling is just how do you move? So you might have the strength and the balance, but putting it all together so your brain can interpret, what's a safe strategy for me to do this so that I am more efficient and less likely to fall. And then if I do fall, how to get off of the floor, because that's huge too. I've been in an environment, I did some home health, and I get there and this older individual is on the floor. How do you help them try to get up? And how do you safely get to the floor too? So one of the exercises that I like to work on is, I call it the marriage proposal position. So I'm going to show you from the side. You could work on this at the countertop, if my countertop is in front of me. So the marriage proposal position is, you're in a stance like a lunge position. So your stance is split. Okay, and then your back heel is up, and you're going to work on bending and straightening that back knee. So you're kind of just playing with that leg. that in and of itself can be challenging. Most people will kind of go into a lunge position, but I want to see this bend back and forth, holding the rest of your body still. Once you get that, then yes, they can move the forward leg, bending and straightening that. So 2 different movements. And then putting it all together, bending this leg, trying to keep vertical and coming down to the floor. Okay, so if people can't do that, which most people have a hard time doing that because they're not strong enough or don't understand that whole process, we can give that to them on a wall. So kind of like the wall slide, you can lunge, because essentially getting to the floor is lunging, even though I called it marriage proposal, is you can lunge to get to the floor. Very functional exercise, great for strengthening. It's a supported position that most people can do. So I'm going to open this door here. Imagine this is a corner of a wall. My one leg is forward like a lunge. My other leg is back, so I'm in that lunge position. And there's not a lot of ways to screw up on this. The technique is pretty good because you're supported, everything's in its proper alignment. So to get down the wall, the only way to go is by bending that back knee. And then the front knee goes along for the ride and your back is upright. You can go as deep as you want. Obviously, if you get down to the floor, you're going to be going down all the way. But to work on strengthening those muscles and kind of building it up in your brain of where are you and how do you do this and the sequencing, you can just do baby ones. You can just use it as a strengthening exercise. You can come down and hold it for a few seconds and come back up. And then you would, of course, find your other corner and do the other leg. So again, essentially, that is, go ahead and rotate that. That is the wall lunge is coming down to the floor, which I'm going to talk about next. So you're down to the floor, right? So then the sequencing, most people don't think about this. They kind of, if I say, can you get off the floor? And they say, yeah, and I said, well, can you get off the floor in the middle of a room where you don't have things to hold on to? Then it's a whole different ballgame. And most people don't think about how do we break this up? That's our job as therapists. We're movement people. That's not your job. So that's what we're here is to help you with is, okay, I'm going to break it up a little bit and make it easier for you. So if you're in this position, then you would go down to both knees and your hands. And then you would come down and then maybe do whatever you're doing and, come off and come down to the floor. And then to get back up, you would just do reverse. You're on your back, you come to your side, come to your hands and knees, and then try to take one leg forward and push through your lunge to stand up. So it's just a reversal. So lunge, both knees down, hands are down, lower your seat and come around to your back. And then you would reverse to your side, to your hands and knees. If you have something to hold on to, I encourage that just for safety and strength. So if you have something to hold on to like a sofa or anything, you're on your knees, you take your hands off, you're on half kneeling position, and then you can help with the surface and through your leg strength that you've developed to get up into a lunge. Now, if most people fall, they're going to kind of, tumble down and end up, in a compromised position. So that's where you would want to try to, they're probably not going to be on their back. They'll be on their side or maybe have fallen on their back. But yeah, you would want to get into that side position, encouraging them then put your hands down. They will be on their hands. And then come into the all fours position. And then the biggest challenge is then going to be, if you hopefully have something to hold on to, taking the hand off to come to to come to this position. And then of course, getting off of the floor. So this is going to be the hardest position. But if they're sitting on their back, to try to have them stand up just by holding their arm is probably not going to work, depending on their size and your strength and their strength. So those are strategies to get on and off the floor. And then the last thing I want to talk about, and we're just going to rotate the camera around here again, and then we can talk and see if anybody has questions. So we talked about physical risk factors for falling, and then lastly is environmental too, right? So what can you do in your home environment? What can you manage getting rid of certain things so that you're less likely to fall and get hurt? So just decreasing clutter, whether you have a pet and there's little toys on the ground or grandchildren, loose cords, or just cords in general. Throw rugs, anything that might be loose where you could just catch your foot underneath and fall, that type of thing. So decreasing clutter, adding grab bars both in and out of your shower and by your toilet, adding railings to both sides of steps if you have them and if you have the ability to use railings, and steps, of course. Having adequate lighting so that you can see where you're going better. And making sure your vision is checked too, so that you can see where you're going. And not only in your environment, but that's a predictable place. So just think about when, you know, your vision, and also along with this comes your hearing. When you're in your home and you're in a familiar environment, but when you go out in the community, you might hear something behind you, maybe. And if your hearing's not very good, you might do a quick turn in, then that puts you at risk for falling. Or likewise, if your vision is impaired out in the community and you're just not used to where things are in your home, you have more likely risk for falling. So making sure your hearing and your eyes and your vision are frequently checked to make sure you can hear and see what you're doing, not only in your predictable environment, but outside in the community. So we talked about having adequate lighting in your home environment, lamps, night lights. A lot of people have to get up in the middle of the night, those types of things to reduce your risk for falling. Also arranging things where there's cupboards at an appropriate height. So most likely your kitchen. So avoiding things that are really low or really high, because if you reach really low, you could fall forward. If you reach really high, you could fall back. So putting most things at a comfortable level within reach. And then using non-slip mats in the shower or the bath, so you're less likely to slip. Using walking aids as appropriate. So there's things we do in physical therapy, certain tests, which are indicators if someone gets a certain score and they think, I don't use anything, I don't need to use anything. And we can say, well, based on the score that we talked about and how you performed on this test, it indicates you should probably be using a cane or a walker, or using a cane only outside. It talks about what assisted device, what should they use for safety, both not only in their home or out of their home. It might be use a walker all the time. It might be, oh, only use a cane when you leave the house, but in your house, it's okay. We have scores for that give us an indicator of a number, rather than us just saying, we recommend this. So taking an expert's advice on what appropriate assistive device to use for safety is important too. And obviously another thing you want to do is make sure that they're wearing shoes when they leave the house. That's very obvious, but a lot of times shoe wear both in the house too. As we get older, a lot of things change. Feet get flatter. You have less sense of balance, as we talked about. So putting shoes on is going to give you a more rigid supportive structure, align your posture better too. So wearing shoes is going to provide support all over. And then in general, pacing your activities. So I talked about, I might work someone kind of hard in physical therapy and don't expect them to do their exercises later in the day, because I want them to pace their activities. I want them to be safe when they go to take their shower or maybe make their meal or do some cleaning. Or I want them to be able to get out in the community and enjoy social things or out into their living space. So pacing your activities is important so you don't wear yourself out too much where you can't do the things you need or want to throughout the day. So we've talked about a lot of different things today. Are there any questions that are out there that anyone might have?
I have a question, Jane. I am wondering, because I know a lot of people on this call and people that we see here are caring for someone living with dementia. So is there certain strategies to help, when you're teaching someone exercises or trying to help them get off the ground, that kind of break things down a little bit more when someone has dementia?
I think keeping things very simple and repeating repetition, and then just avoiding any other variables around in that area. Whether you're teaching exercises, you're going to probably have to do them with them and just be very repetitive and consistent with the time of day that you do it. If it's they respond better in the morning, if they're a morning person, and then just being consistent with it to avoid any other distractions or variables. And then getting off the floor, just keeping it very brief, and they're already going to probably be very overwhelmed and in a little bit of state of anxiety. So just walking through it and slowing down step by step to take them through the movement strategies we talked about. All right, well, it was nice speaking with you all. Yeah. If you have any other further questions, you could probably talk to Abigail and she can direct them toward me. She knows how to get a hold of me. I'll also, I think, give my email to Abby. Well, she has it as a resource for you guys if you have extra questions. Okay. That would be fine too. All
right. Thank you so much,
Good
Jane.
luck. Yes, you're welcome.
Yeah, this was wonderful.